Welcome back to VetFolio Voice, everyone. In this episode, I'm once again joined by our resident CVT, Sam Sacasa, to discuss one of her passions, which is shelter medicine. This was another episode that we were able to record in person at the NAVC Institute, which really added an extra layer of fun. Sam and I discussed her experience working as a technician in shelter medicine, including topics like managing public perception, rewarding and difficult cases, and ways in which working in shelter medicine can be a rewarding and fulfilling career. In case you haven't caught up with Sam on a previous podcast episode, a webinar, or a vet-to-vet tech takeover, let me tell you a little bit more about her and then we'll jump in. Samantha Sacasa earned her bachelor's degree in education from the University of South Florida in 2008, and her associate degree in veterinary technology from Hillsborough Community College in 2013. Since becoming a certified veterinary technician, Sam has gained experience in emergency medicine, general practice, shelter medicine, and her personal favorite, wildlife conservation. She's also taught as an adjunct instructor at her alma mater, Hillsborough Community College. Sam's professional interests include continuing education for veterinary professionals, fostering the human-animal bond, improving workplace wellness, and the Fear-Free Initiative. In general, she's passionate about improving the lives of animals and elevating veterinary medicine through education. Sam's honored to be a part of the VetFolio team, where she hopes her knowledge in veterinary medicine and her experience in education will aid in her impacting the profession in positive ways. In her spare time, Sam loves traveling and enjoying the outdoors with her husband and 2 kids. She has 2 dogs, a cat, and 4 fish, all of whom bring tremendous joy. Let's go ahead and jump in. All right, for this episode, I'm once again joined by our very own Sam Sacasa, CVT extraordinaire, and we're going to talk about shelter med, which, Sam, I know you have a background in shelter med and a love of shelter med, so can you tell us a little bit more about that?
Yeah, absolutely. So I did have a shelter med rotation when I was in tech school, and I had a good time, but I was like, I'm never going to end up here. Like, I had other things that I really wanted to do. And then after I graduated, I was at a private practice for a while. And then a position opened up at a shelter. And I don't know why I ended up going for it, but I'm so glad I did because it just surprised me how quickly I fell in love with it. So that was 10 years ago. I was at the shelter for, I want to say, about 6 years. And now I've been, spending time here and there relieving. But yeah, I was full-time for 6 years.
Very cool. And so I will be honest, like when I think of shelter medicine, so many things come to mind, like different types of practices, different needs depending on the area. Was this like a humane society, or are we talking, I'm showing my ignorance here, like animal control? Like we have a program at the university where, we have a shelter med program. We have nonprofits and community outreach type of services. What kind of environment were you in, and what role were you playing?
Sure. So I do think that is a pretty broad term, so I don't think you're wrong there.
Ooh,
like when I think of shelter med, I also think of like community outreach, low cost clinics. So it does encompass a lot. So I actually worked for an open access county shelter. So I worked for what you called animal control. And I was a technician. So that meant surgery, that meant exams, that meant treatments. Yeah, I was all over the place.
You did it all.
Yeah.
So did you have like a single doctor that would come in? Kind of like we think of in a general practice where there's a doctor who would come in and then you would work with that doctor to take care of all of the shelter animals? Or was it more, did you have more on your shoulders than that?
So yes, I definitely did have a lot on my shoulders, but in the best way possible. So there would be, sometimes one doctor. A lot of times we would have 2 or 3. There were times that we were more like adequately staffed. There's kind of always that ebb and flow. So what would usually happen is that there would be a few of us helping a doctor with like our high volume spay and neuters. So that would be anywhere between like 20 and 70 surgeries.
Goodness
during
gracious.
that day. Yeah, it was a lot sometimes, especially if we had a lot of, like in the summertime when it's kitten season, like we would just do so many cats. And then there would always be, ideally 2, but sometimes only 1 technician that would work with another veterinarian, and they would do exams, right? So every animal that came in before it went up for adoption would have a wellness exam, and a lot of times that would determine the route that we wanted it to go. So sometimes animals would be rescue only, if they had more medical needs, that sort of thing. So we would examine all the animals. And then there was a dedicated technician for treatments, and that was honestly an all-day job because you have a lot of animals that are on, oral, eye meds, ear meds. And that's also the person who's like changing bandages, like just doing so many things, nebulizing patients. So that would end up being like an all-day job. And if they had time, they would help out the exam vet. So yeah, there was a few different areas.
Very interesting. I mean, just tons of experience.
Yeah, it is a lot of experience. I saw so many animals while I was there, and every day, like, different things are happening.
It sounds like it. Never a dull moment.
Mm-hmm.
I honestly didn't know that I didn't know this much about shelter med until we started talking, and I went, well, goodness, I don't even know what I'm talking about here. So what do you wish that more people did know about shelter med?
So I worked in an open access shelter, and, I've heard a lot of criticism about that throughout the years, usually from kind of lay people that don't know a lot about veterinary medicine, and sometimes from people that are in veterinary medicine. I wish people would keep in mind just how much of a response open access shelters are to a community problem, right? So there has to be a place where you can kind of surrender animals. Shelters, I don't like to use the term cherry pick, but they can sort of decide, what animals are adoptable that they want to take in. Yeah, right. You're triaging, but for adoptability. And you have like those stringent hours that you're open and, So where I worked, it was more that we were taking in animals that animal control officers would, confiscate, bring in. We had all of the investigations for that county. We would take in all the animals that were surrendered, regardless of breed, adoptability, medical health. So you're sometimes really overwhelmed with how many animals you get. Some days it's explainable, like if you're getting, animals that were confiscated from a hoarding case, and then some days you're like, oh my gosh, why are there so many animals here? Nothing happened. But some days it's just really a lot. So I just wish there was more understanding about the response to the community problem of overpopulation and how we're all just doing our best. And that sometimes when animals are, let's say, like euthanized for space, that might be a dog that's on ace-promazine and has been for 7 months and has been living in a shelter and seems really unhappy. Or, there's just so many different circumstances. But that at the end of the day, people that work in open access shelters are so committed to animal welfare and are really doing research and doing the best they can to solve that problem.
Absolutely. And, gosh, we could go down like a whole trail here. We're seeing animal population numbers go up, spay-neuter numbers go down since COVID, which is creating, some issues that we haven't seen in a long time. And, the long-term implications of that remain to be seen. But we did see something that kind of speaks to what you're talking about in our community where we didn't have space. And so we would get animals dropped off at the hospital where that was not a normal occurrence because people were just letting them out to run the street. And they would either get hit by a car or someone would say, I found this dog, and the poor person who brought the dog in and was honest with us and I found this dog, I want to leave it with you. And we were like, no, you can't,
right.
You can't leave it here. We don't have anywhere to put it.
There's a place for that. It's animal control.
Yeah, rather than the drop and run person who was like, here you go, bye.
Yes. I've seen that happen a few times too when I worked in private practice.
That's how I got my first dog. One of those.
Right.
But yeah, like you said, it's a response to a community problem. And, it's something we may see as a result of some of the trends that we're seeing with spay and neuter and stuff like that. But we certainly saw it very acutely. It was short-lived, thank goodness. But when the shelters ran out of space, these animals were not safe. They were in the middle of the road. They were out on their own trying to survive. And that's just, that's not an okay situation for them either.
Yeah, absolutely. So yeah, that's part of the responsibility of an animal services is, keeping animals safe and also keeping us safe, right?
Yeah.
Yeah.
Yeah, absolutely. So it sounds like you've seen, your case range has kind of run the gamut here quite a bit. What are some of your most memorable cases?
There are so many cases that were so memorable. One time, right, because of course all animals get scanned for a microchip when they come in, but this dog, nobody found a chip. So they brought it to me. It was maybe a Lhasa Apso. I don't know. It was a little extremely matted dog that you can tell had been on the streets for probably a long time.
Wild Lhasa Apso.
I know. It was geriatric and it was so cute and sweet. So I started shaving it down, right? That's what I was doing. Because as the technician at the shelter, right, like we were talking about different treatments and things that you do. And syrup, before that dog even saw a doctor, I was kind of doing that. So I was shaving it down. And then I was like, you know what, I'm going to check for a microchip one more time. And sure enough, I found one.
Oh, no. It was just under all the matted fur. It couldn't read.
I don't know why I didn't read, And so I called the owner. And that dog had been missing for 11 months. And she was so emotional. And then she came to pick up the dog, and there was not a dry eye in the house. She was crying. We were all crying. And it was just such a nice reminder of just how much, people love their pets. And how lucky is she to get her dog back? Because I'm sure after that much time passed, she probably didn't think that was possible. And so that was beautiful. And we had once a dog that came in with a pig, and they were heavily bonded. And they had to be in the same little run. Otherwise, the pig would start screaming.
Oh, my God.
It was so funny. And they actually got loose. So they weren't dropped off or anything. So the owner did come for them like a day later.
Oh, I was picturing like they got loose in the shelter and were just like running amok through the kennel.
That would definitely be memorable. But they were still memorable just because they were adorable. And it was so cute how bonded they were. There was one dog, Bella. She's probably my favorite. She was an 11-month-old pitty that actually had gotten dragged by a car. Yeah, it was terrible. So she had 1st degree to 3rd degree burns all over, I think it was her left side. And usually a dog like that would be euthanized. Like she just had so much going on. But she was an investigation and she was such a nice dog and we just wanted to try to do right by her. So a veterinarian took the case on and we all took it on with her. And she had to turn into like a plastic surgeon because she had to reconstruct the eyelid. We just had to do so much for this dog. We had to do a CRI, which we don't do often because we're not there overnight, but we figured it out. And, she had just huge wounds on her side. And one even ended up dehiscing and, the doctor had to go back and do it again. It was such a time-consuming case, but she was such a nice dog, and we all felt so proud to give her that second chance at life. And sure enough, she went to a rescue, and the rescue kept in touch with us and found her a great home, and we saw pictures of her in her new life. And she was the sweetest thing, and so she had a raw deal the first few months of her life. But that was a case that I always felt so proud of because we just did so much for her, for being a shelter. And
absolutely.
It was a point of pride for us.
Oh gosh, it breaks my heart and it warms my heart at the same time.
I know, it was so sad. But yeah, you kind of have to look at the bright side in those situations.
Absolutely. I think one of the other things I'm hearing you say is, it's important not to pass judgment. You had this little Lhasa Apso who had been out on the streets for 11 months, and it would be, I think, easy in that scenario to bring that dog in and say, oh, your owner must not care about you and must have just let you go, and all these horrible things happened. But no, the dog had gotten out and done what dogs do because that's what they do.
I can't say that I've never had a dog that kind of ran out when I wasn't prepared for it and had to chase it around town a little bit.
Absolutely. Absolutely. Yeah. And then this one, just happened to get into a bad situation and not make it home. We had a cat patient like that, just a quick plug for microchips, rehomed back to its original home after being on the streets for 3 years after getting out in a car accident. And the owner was in a car accident, opened the doors, the cat got out, was not seen for 3 years, and then showed up at our clinic. I think it was a Persian, and that was kind of our first clue. We were like, you aren't supposed to be wandering around on the streets. And had a microchip and went home after 3 years.
Oh, I love that.
Those are always, those are the cases. They're so heartwarming. I feel like we may have answered this in a lot of ways leading up to this point, but can you talk about why you love shelter medicine? I mean, it sounds like there's a lot to love.
The work is so rewarding, right? I love working with animals, especially my little hard knock buddies.
I love that.
As a technician, I would say that I think shelter medicine is such a great opportunity because you get so much autonomy. You're doing so much. They really utilize their technicians. Like a doctor would just write me a list like, hey, this dog needs rads, this dog needs blood work, this dog needs this, and this, and find whatever technician's available and get it done. So I just think that it is not just like emotionally rewarding, but very mentally rewarding for technicians. I also love the human aspect. We talked a little bit about like judging owners for maybe, finding their animals in certain situations. And, sometimes I do think judgment is warranted, but there was also a lot of times when I felt so much compassion for the owners. Like I had once this gentleman bring in a dog that was laterally recumbent and dying, and he kind of just brought it in like to kind of say, hey, my dog's dying. Can you guys euthanize it? And I'm like, okay. But he was like so appreciative of me. He was like, thank you so much. And he like gave his dog just this really sincere kiss. And I was like, oh, this would be an easy situation to judge because why isn't he with his dog at the end? Or why isn't he taking his dog to the vet or, seeing what's wrong with his dog? And how did it get so bad in the first place? How long has this dog been this way? So I understand the thought process, but I also have compassion a lot of times for people in those different situations. And so I love shelter medicine just because it gives me the opportunity to maybe be that smile that a person might need in that moment.
That's really beautiful.
Thank you. A little emotional.
Well, absolutely. Those are really important moments that everybody needs. This man needed somebody to put his dog down, even if he didn't go about it in a way that we would think, these are like the quote unquote, maybe like the more normal options to do this. Like he needed it done and he sought the care that his dog needed in that moment.
Right. Exactly.
And so, you may have spoken to this a little bit too, but, we talked about a lot of the heartwarming cases and, some of these wonderful moments. Are there any challenging moments that you can speak to? Things where you were like, this part of it was really hard, or a particular case, anything like that?
So we did see all the investigations. So a lot of cases of abuse and neglect. So that a lot of times would, make all of us angry or sad. Bella, like I was tasked when she first came in with like sedating her with Dex and like scrubbing her wounds. And it didn't matter how much sedation I gave this dog. Yeah. She could feel it. Mm-hmm. It was like.
They're so painful. And you can't do locals because they don't work because it's too inflamed.
I had never experienced a dog that was so reactive, like Poor even baby. Under sedation. It was, yeah. But she was a success story.
Yeah, exactly. Yeah. Exactly. Yes, I've also been a part of, like hoarding cases in particular and things like that. And yeah, it can be really challenging emotionally.
It can. One time we had a huge hoarding case with about 200 cats.
Goodness gracious.
And almost every cat had URI. They were all so sick. And of course, like urine scalding, like just so many things were wrong with them because of the environment that they were in. And it was so physically taxing. We literally had to create an assembly line to like get this done in any sort of reasonable time. And I think we still were there hours after we were supposed to be. But it was like one person was doing intake, the next person was doing vitals, the next person was helping the doctor with an exam. Like there was just all these little parts that we had to play. But it was really shocking. Like I just couldn't even imagine what that person's house must be like.
Don't even want to think about it.
I know.
But this brings up a really interesting topic to me, something that I find fascinating about shelter med, and that's infection control. Mm-hmm. So you had to intake roughly 200 cats with URIs. What do you do with those guys?
I know, and we were almost full all of the time, so I don't know, the creativity that goes into it is a little above my pay grade. But what I will say in those situations, right, because there's almost always, I feel like, chronic URI in any shelter that I've been to. There's like wards, there's like a room full of runs, and that will be the dedicated place for dogs with URI. And then for these cats, all the healthy cats kind of had to get smushed together in like the 4, other cat rooms. And then we had to have a URI cat room. Or I think we probably had to have 2 or 3 URI cat rooms because there were so many of them. Yeah, so you just have to separate. Of course, there's very stringent cleaning protocols. For parvo, there is their own separate ward that's like far away from all the other animals. And the person that works with the parvo animals doesn't work with any other animals that day. So even though you're wearing a gown, you're wearing all the appropriate PPE, you would still, maybe if we were understaffed for some reason, maybe change your scrubs and work with other animals. But even using your gloves, using everything, they would still keep that person dedicated to parvo.
Sure.
So yeah, there was a lot of different things that we did to try to control infection. And they even cultured the URI a few times, but we just were never able to get it under control.
Oh, it's so tough to get those under control sometimes.
Yeah.
How do you feel like shelter med has kind of evolved over time?
So much, and I'm so glad for that. So when I first started 10 years ago, the thing that everybody was talking about was how they no longer euthanized heartworm dogs, right? Which to me, I'm like, oh my goodness, I can't believe that was ever like the thing, but apparently it was. That was, a change that had happened kind of around the time that I started. And I would hear stories about just how many animals were euthanized for space, like I want to say it was like 70% of the cats. It was like a huge number.
Sure.
But then shortly after I started, the director came on and started an initiative to have, I think, a 90% live release rate, which we achieved, pretty quickly, actually. But there have been so many things that have changed. Even the Parvo Award that I was just talking about, that didn't exist. So my first couple of years, we euthanized parvo dogs.
Oh.
I know. We euthanized Pan-Luke cats. And then eventually we had a doctor who was really passionate about shelter medicine and kind of did a lot of research and training. And she was the one that came up with the Parvo Award. So I'm so happy for that. In terms of cats, we stopped euthanizing Pan-Luke cats, which I'm very happy about. But yeah, when I first started, we were still euthanizing FIV and FELV cats, which
Sure.
we stopped doing. And it was like once we came up with that protocol of just, hey, you give the client, education, like you discharge them and you let them know how often they have to go to the vet and what like life is going to look like for that cat. And I was like, oh, that makes so much sense. I wish we had done that from the start. But it's like things have to evolve. So yeah, I'm happy that we started adopting out those cats again. We came up with a really great orphan kitten protocol because those were also pets that, we get euthanized a lot, where we would just figure out how to get them out to like rescue or foster as quickly as possible. So like promoting those rescue and foster programs are huge for shelters because sometimes you are like over capacity. Like when we had all of those cats, it was like, okay, how can we get as many healthy animals out as we can? And so you call on your friends, and so.
And I know that definitely happens where, if in kitten season, like you said, like who knew there'd ever be a kitten season, but here we are. But yeah, they'll reach out to local veterinary practices and say, hey, does anybody want to take on kittens because they need to be fostered and you guys know what you're doing for the most part.
Yeah. And that's, that's awesome.
Very cool. And I would imagine that probably opened up a lot of space and really not only got these orphaned kittens adopted out, but also opened up space for some of the adult cats coming in. So there wasn't as much euthanasia for space going on.
Absolutely. And it is like such a symbiotic relationship where it's like we're not just asking you to take these cats and then we're going to leave you hanging. Bring them back so we can spay and neuter them. Like, we're not going to make this a financial burden for you. There's just a lot of working together in those situations. And luckily, I think most places are able to find a network that really helps them with their population nowadays. So many people are dedicated to animal welfare.
It's so true. It's so true. And I know now that I'm positive that there's so many people out there listening who are just riveted by this and are like, so much about shelter med that I didn't know. What would you say specifically to technicians who maybe they were already interested in shelter med, or maybe after listening to all your stories, they're like, this sounds really cool. I want to try this out.
I would say to go for it. I've heard so many people say, oh, I could never do that. It would break my heart. And I know it's not for everyone, but if there's a part of you that feels like, oh, but I would like to try, like if there's a part of you that's tugged in that direction, I would say go for it because yes, it is emotional work, but it's so rewarding. I would also say to ask a lot of questions. It is such a good opportunity for technicians to learn and grow and just learn how to do like all the things. I would also say ask questions about like protocols or the way that things are done because it's already such a busy atmosphere that I think sometimes they are maybe a little slow to evolve. So they need people like, who we were talking about, the doctor that kind of spearheaded our parvo quarantine. They need people to ask questions, make suggestions, like don't be afraid to be that voice. Yeah, sometimes you might just get blown off, but sometimes somebody might go, oh, we probably can do that. And then you're like saving lives. So have confidence in yourself and know that your opinion matters. I would say definitely prioritizing work-life balance and boundaries, because shelters can get super, super busy. There were so many times when it was like time for me to go and there were still like 7 animals left to be like intook and I was on intake that day or something like that. I had to learn how to sometimes, set those boundaries to make sure that I didn't feel overworked, because since it is an emotionally taxing job, you just have to protect yourself a little. But I loved it, and I think that a lot of people in that environment would probably love it. So I always encourage technicians to go for it.
I think that's all amazing input on just working in that environment and the kind of impact that you can have. I mean, you're talking about population medicine here. So yes, emotional work and, sometimes having to deal with some really tough cases and some really hard decisions, but just impacting so many animals on, at such a high level to have such a really big impact on the well-being of so many animals. I mean, that's a really powerful space to be in. And so I think that's really good advice to give credit where credit's due, including giving yourself credit, and speaking up if you see something, but also, like you said, making sure that you're setting those appropriate boundaries and preserving your own mental health and well-being, because I would imagine that it could be easy to kind of fall into a trap of like, but look at how much good I'm doing, and just, try to do more and more and more and get yourself into a bad situation.
I do see that from time to time, and I think that honestly happens all over veterinary medicine.
True.
Like we're all just hardworking to a fault, I think.
That's fair. That's fair. Well, Sam, this has been amazing. I've learned so much about your experience in shelter med. Clearly, you heard from the very beginning, I didn't even know what I didn't know. And I feel like you have done such a good job kind of illustrating your role and some of what goes on in a shelter. So thank you so much for joining me.
Oh, thank you. I had a great time.
Thank you so much, everyone, for joining us. Thank you, Sam, for coming on the podcast again. I always love talking with you and hearing your insights. For more episodes like this, click on the Education tab on the VetFolio website. As always, we'd love to hear your input on this talk, as well as ideas for topics you'd like to hear from us in the future. Feel free to reach out to me at dvm@vetfolio.com. You can also visit my Facebook page at Dr. Cassi DVM, and you can find me on LinkedIn. And remember, if one animal is better off because of you today, it's a great day.